the MS Michigan Man 64 podcast. My name is Brian Wallace, and I am the MS Michigan Man 64. The MS Michigan Man 64 podcast is about chronic disease awareness. I have had multiple sclerosis for the last 27 years. It's an invisible chronic disease that I've been battling for half of my life. I want to share with you what it is like living with the chronic disease from my experiences and the experiences of other chronic disease warriors. We can fight to have a voice to those that want to listen. Together, we can motivate and educate. Hi, welcome back to the MS Michigan Man 64 podcast. Today, I am really excited. I have a kind of a dual guest on today. I have an MS warrior. Her name is Summer, and she was diagnosed with her MS in 2017. But the really, really cool thing about this also is that Summer is actually a doctor. She was in her residency in 2017 when she went through her symptoms and got her diagnosis. And she wanted to come on just to talk about her MS journey and what she went through. Please welcome to the podcast, Summer. How are you doing today, Summer?
I'm doing well. Thank you for having me on.
I appreciate you, Summer. Anybody that wants to come on and talk about their journey just to help people understand this disease better. And then I got the added plus that you are a doctor. I love this. This conversation is going to be great. I met you on TikTok a couple of months ago, and we really had a cool conversation, couple of cool conversations just about living life with MS. And I know that you started your journey out not too long ago, Summer. You were in your residency. You were just getting ready to actually be a doctor and start a new chapter in your life. Can you kind of take us through your diagnosis and how you ended up with the diagnosis of MS in 2017?
Yeah, so in 2017, I was in the third year of my internal medicine residency, which is a 3-year program. I was actually at the very end of it as well. I was 6 weeks before finishing that residency when I had my first episode of transverse myelitis that for me initially involved just my lower extremities. So I had a lot of numbness in my left leg. I felt like I had water in my shoe starting on like a Friday night, and it just progressively got worse throughout the weekend. In addition to that, over the course of the weekend, the right lower extremity, so my right leg, went from being able to move to not being able to move at all. And I went ahead on Monday morning, went to the lecture portion of residency, which is 4 hours of didactics. So sitting in there listening to all these different lectures from different people, I did not have to present that time, which was probably a good thing. Sat through that, went to my rotation with, at that time, was our program director. She also happened to be the CMO of the hospital. She was a hospitalist, another internal medicine doctor who was absolutely phenomenal. She was brilliant, still is brilliant, a wonderful physician, kind and compassionate. And I went and asked her, hey, can I talk to you, Dr. Nickel? And she said, of course, and took me into a separate room. And the first thing she asked me when we walked in there is, what's going on? What's wrong? And of course, she could see that I couldn't really walk well. I was dragging a leg. And then, of course, she did the standard thing that happens during residency, which is, they call it pimping, which is a lot of asking you questions about, okay, patient presents with blah, 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 blah. What do you suspect? What tests do you run? All the things to get you to a diagnosis, and then what do you do to treat it? And at the end of her doing that, she asked me, what do you think you have? And I said, I'm pretty sure I know what I have, but I don't want to say it out loud because it will make it real. And she said, well, I think you have multiple sclerosis. And she ordered MRIs, brain, cervical spine, thoracic spine. She also ordered lumbar spine, even though lumbar is not usually involved, because I had a history of being in a car accident when I was much younger. And so she wanted to make sure that it wasn't something from that. But she sent me for a lumbar puncture. She's the one that started me on steroids. She's the one that first referred me to neurology. I don't think I would have had any diagnosis in any period of reasonable amount of time had it not been for this woman.
Yeah,
But
sounds
that
like
was
it.
the start of everything.
Yeah. So when that doctor said that you had MS, and I mean I know you understand what it is. You're a doctor. You know, did you kind of like just go into denial with it, or did you like? I mean, did you understand like okay, this is going to be my life for the rest of my life. I got MS.
I understood, but I also went into somewhat of denial in that I still did all the follow up testing. I still saw the neurologist. I still started on treatment, but I also had so many other things to deal with. Like you said, I was just starting my career. I had already signed on for my first attending position. I had other things to focus on. I still had to focus on studying for my specialty boards. So
Yeah.
I was in denial in the way of like, yes, I did the treatments. Yes, I did all of that. But I was in denial as far as I didn't face what was going on either. I didn't take the time to process it.
Right. I understand that. I mean, yeah, I mean, just the fact that you're just getting ready to become a practicing physician, and the fact that you had two kids at home too, right? So, I mean, you're still being a
Yeah.
mom. I mean, you got other things that are all, everything else is going on. So, I mean, you're just plugging
Right.
along. You're just like, okay, I got MS. I'm just figuring it out day by day, and that's the way you kind of approached it.
And, and my youngest son, you mentioned my two kids, and you're correct. I had two kids. I went to school as both undergrad and med school and through residency as a single mom of two. One of my two, he has epilepsy, something called a primary immune deficiency. He had a lot of medical stuff himself that I had to focus on. I had other things. Did I do the test? Did I do? Yes, I went to all my doctor's appointments. Yes, I did all that. But I had other things to focus on and making sure that not just my patients, but my own son was okay.
Yeah.
So I didn't take the time to really think about what does this mean for me,
Right.
other than go to my appointments, do what I need to do.
Yeah, and just keep on going. I mean, because you have to. I mean, that's life doesn't
Yeah.
stop because of a diagnosis. I mean, life isn't going to stop. You got
Right.
to keep on doing what you're doing. So,
Right.
so then
And
in the next 18 months, you are actually like, I mean, you went from your diagnosis and then 18 months later, you're in a wheelchair.
yeah. So that occurred over the course of that 18 months. I had, including that first that I was just talking about, 3 episodes of transverse myelitis that works their way up. So the lower extremity is the first one. Second one was kind of mid chest and down. And then the last one was kind of my cervical spine and down was affected. So I went pretty rapidly from one thing to the next and got very rapidly worse. Despite going to my doctor's appointments. I mean, I was initially started on Gilenya. Within a few months, I had my second episode of transverse myelitis. So at that point, they switched me to Tysabri, which did well for about a year. And then I had my last episode of transverse myelitis. And that's when they made my first change in diagnosis was then.
Yeah, I know we had a great conversation about that. You told me about your second diagnosis, and I'm like, I didn't even really know what it was. It's NMO. Can you kind of like
Yeah.
take us through that transition of your diagnosis and what exactly NMO is?
So 18 months into this, I end up with my third episode of transverse myelitis. And at that point also had optic neuritis twice. And at that point, I'd been through Plex twice. So plasmapheresis with the third and the second episode of transverse myelitis. And at that point, they were reviewing some of my imaging and noticed that I to this day, but especially then, did not have a lot of brain lesions. Almost all of my lesions were spinal cord, and they were a lot longer than expected in MS. They're three vertebrae lengths. So taking up the spinal cord that spans three vertebrae. That is typically considered more of an NMO thing. And at that time of the MRIs, they couldn't really tell as well if they were centrally located or on the edge of the spinal cord. They looked more centrally located. So they switched my diagnosis at that point to what's called seronegative NMO. So NMO is neuromyelitis optica. It used to be considered a form of MS until about 2005 when they discovered true antibodies that can cause NMO. For MS, they still don't know the actual antibodies that contribute to it. But for MS, for NMO, they found aquaporin 4 and MOG. And there's various forms of NMO spectrum disorder, which can be seropositive, seronegative, MOG disease. They're all kind of in this separate area that used to be considered a very aggressive form of MS.
Right.
Seronegative means you just don't have the antibodies, but you have all the other markers of NMO.
So, and then
So,
when they switched you to this, and this is the thing, you said the mortality rate in the NMO diagnosis is 5 years, right?
it was is particularly, and it still is with some of the forms of it, like seronegative forms. But for seropositive, it is extended now because they have, at the time they re-diagnosed me, was the first time they had found an approved treatment for NMO.
Mm-hmm.
So that would have been in 2019. That's when they found some treatments that work. To this day, there's still only, I think it's 4 or 5 treatment for seropositive and none for seronegative.
Yeah.
But yeah, the prognosis pre those meds, which as seronegative, you don't have access to those medications,
Right.
was 5 years. From the time of diagnosis to the time you would die was 5 years.
So now you're not only processing a diagnosis of MS, which, I mean, a lot of us get, but now you're being told that it's NMO. And, now you're looking at a 5-year window. I just couldn't even imagine what's going through your head at this time, Summer.
It was scary, but again, kind of like before, I've got a lot of other things going on.
Yeah.
So I just basically said it's not going to shut me down. I'm going to keep pushing forward, and hopefully more treatments will come around during this time. And for seropositive NMO, that has happened. They actually do have a longer lifespan now, longer life expectancy now. It's still not great. But the other big difference, and I did want to bring this up, between NMO and MS is NMO is always relapsing remitting. There is no progressive form of NMO. Each relapse statistically, and again, not everyone is like this. There are MS patients that have horrific relapses, and there are NMO patients that their relapses are a little bit more mild by comparison, right?
Mm-hmm.
But statistically, NMO tends to build disability very rapidly.
Yeah.
Very, very. So, like when you mentioned, I went from this to this in 18 months, that's actually pretty common in MS. I'm sorry, in NMO. In MS, it's less common. It usually takes more years or even to get to that progressive phase before that occurs. That does not mean that MS patients have an easier disease. It's just enough different, right?
Right. Right. And then and then the real interesting thing is then they flip you back to MS after like
Yeah.
another year or something, right?
No, that actually took up until this year.
Okay, that's right. It
So
was
that
this
actually has
spring. Yeah.
taken,
Wow.
yeah, that actually has taken almost 6 years before they switched me back to MS. And that actually occurred because I started having progression over the last year. So I started having progressive symptoms without new lesions that clued them into, hey, maybe this isn't NMO like we thought.
Mm-hmm.
Maybe this is MS. And at that point, I was sent to Mayo Clinic. That was April of this year. I'd have to look at my calendar, but I believe it was mid-April of this year. And when I was at the Mayo Clinic, that's when that was the first time since 2019 I've had any additional spinal cord imaging done. And my brain does have lesions, but not many. My spinal cord has a bunch of them. But they could also see where even my original lesion was actually more to one side, although it was really long, and although it does in some places take up the entire width of the spinal cord, it still is more left sided than it is central.
Okay.
And so between that, they said, oh, we actually, that, and now I'm having progressive symptoms. They decided that actually we think you have MS with pura, which is basically, it's in under old terminology, it's secondary progressive MS.
Mm-hmm. Gotcha. Gotcha. So, and then your treatment path on this is Ocrevus still then, right?
It actually was until this spring, because this spring I actually, so last fall I had another relapse that was a little bit like it was aligned with a new lesion.
Mm-hmm.
But in addition to that, I started having rapidly falling IgGs, which is normal on any B cell depleter. Like it does tend to happen. And so they were considering changing me anyway. And then they changed me to Mavenclad. So I actually just started that about the same time I went to Mayo.
Okay, okay. You know, actually, that was my last EMT. I finished my second round last June. So I've actually been a year off of Mavenclad, and I actually have done really well on it so far. It's going on 2.5 years. I haven't had any relapses, so I'm pretty happy.
And I hope that's how I am. I hope that's how I am because I've had such aggressive disease.
Yeah,
Mayo Clinic, and I've actually switched to a new neurologist locally compared to who I had before when I was initially started on Mavenclad. And it's not even that the neurologist I had previously was a bad neuro. She was fantastic. In fact, my current neuro was her teacher when she was in fellowship. Had nothing to do with whether she was bad or not. I switched because the practice she was in was so layered that I could never talk to the same person at once.
gotcha.
So I switched to where I'm at now, which I will tell you this. I know we did not discuss this earlier, but I will tell you this. My current neuro is Dr. Aaron Boster in Columbus, Ohio. He has a YouTube channel, and
I've heard of him.
I don't want to promote it, but
I've
he is
I've actually
amazing.
heard of him.
Any MS patient should actually go watch this.
Yeah,
Any MS patient or anyone that has someone in their life that has MS should go watch his YouTube channel.
yeah.
It will give you so much information. He is an
He,
amazing physician.
and he's down in Columbus, right?
He is.
Yeah, that's what I thought. I thought he was
He
down in
is.
Columbus too. Yeah, yeah. I've heard that his channel is really cool. Let me ask you this,
It's
Summer.
good.
When you went through this, and you know, we talked. You had two kids. How did they understand the disease? I mean, mom's a doctor. Mom's going to be a doctor. And mom's working to be a doctor. How did they understand this disease?
Um, I don't want to answer for them particularly in that I know there was a lot of kind of they had to get used to it. They had to figure out what I could and couldn't do.
Yeah,
But they always have been like, you can tell when they're worried, but at the same time, they're always like, my mom can do anything she wants to do.
yeah, right.
Very, very supportive. I do think that my youngest one is 21 now. Well, he'll be 21 in September. So when I was diagnosed, what was it, 2017 to now, you're looking at 7 years.
Yeah,
I mean, he was 13,
right.
right? I,
That's a tough age. I
I
mean, you know, they're just you know, just teenagers, just creeping into the teenage years, and it's hard for them to process something like that.
Well, I think he was in a slightly different position because he's also the one that has epilepsy and a primary immune deficiency. So for him, being involved in medical care I started undergrad when he was like almost 3. He's only ever seen me study. He's only ever seen me do this, and he's only ever seen me be his mom when he has medical issues himself. That for him, it was kind of like, oh, okay, so we do this for mom too now, not just me. My older one, he was already out of the house and kind of living on his own. And I don't fully know how I don't know how he processed it as much.
Mhm.
I do know that he gets concerned at times, but at the same time, he's always like, well, you get to dictate what you are able and not able to do. And they both take it very well. To be fair, they're both really good
That's
kids.
it's important though, isn't it? I mean, it's just important
Mhm.
to know that you have family members that, they might not understand it, but they just get it and they like learn to understand it, I guess.
Right. Even at their own pace, like even at their own ability to be like, okay, you can't do like, for example, they always were very good with well, one day she could do this and the next day she can't.
Mhm.
Like there was never any kind of, well, you could do this yesterday, why can't you do it today?
Right. Right.
It was always for them. And my husband, very much like, okay, well, fine, you can't do it today. That's good.
That was going
Tomorrow you might be able to.
well, that was going to be my next question too, is that I know that you said that this was your second marriage and you guys got married in 2019. You got diagnosed in 2017. So how did he process it? I mean, when you guys were dating, were you when you got diagnosed, were you guys already dating?
No, so we were actually so he and I actually it's kind of funny. He and I actually met on Facebook and we met on Facebook via um a lot of the concerts and festivals that both of us have historically gone to even before knowing each other. And it's through those type of Facebook groups, right? And
Mhm.
evidently at some point he decided to slide into my DMs and I basically shut him off, like I blew him off. I
Ah,
don't remember it, but whatever.
uh,
Um, we have a bunch of mutual friends who said, "Oh, you guys should be together. You guys should date. You guys would be great together." And he was like, "Oh no, she blew me off already." I don't even didn't even remember him at that point. And I was just like, "Well, no, I'm busy, whatever." And then one of our friends held an anti-Valentine's Day party. And it was after I was diagnosed, but I was very early in my diagnosis and I was still actually walking at the point. I didn't need crutches yet. I didn't need anything at that point.
mhm.
Um, and they held an anti-Valentine's Day party that we both were at, and we've been inseparable since. He also grew up with a cousin that had meningitis as an infant, and she ended up being what's essentially called total care. She was very disabled her entire life. He grew up in a school system that had him volunteer as part of their this is what we do with at schools for children with disabilities in their area. So people with disabilities for him of any kind were never shocking to him. He was like, okay, this is what they do. This is how they function.
Yeah.
No big deal. We deal with it.
And
So
I wish the rest of
he
society
ended up
were
being
like him.
oh, me too. He ended up being the perfect partner though, because of all this previous life experience
And that's
right?
awesome.
Like he kind of got it. And so he like my last major relapse that was the one that it's my last major relapse was the one that made them initially think I had NMO. Everything since then has either been progressive or minor. And my last major relapse, he was the one that carried me into the hospital, right? So for him, this has just been like, okay,
Yeah.
this is what we do. I
Yeah.
care about her. I love her. Of course, I'm going to do this.
Yeah. It's just
I'm
part.
so lucky in comparison to so many.
Yeah, I think it's a beautiful story. I mean it, and that's just so important. I mean, I don't care if you're a doctor or not. I mean, it's just so important for our mental health just to have somebody in our lives, in our circle that gets it, and especially when it is a spouse or a boyfriend, girlfriend. It just, it's,
Anyone.
yeah, it just,
Yeah.
you need the
And I
support.
will say I've been extraordinarily lucky, both in terms of the physicians I've had around me. Even though there was a change in my diagnosis and a change again, despite all of that, I have been extraordinarily lucky to have good physicians and fantastic family support that a lot of people just don't have.
Yeah. Yeah, they don't. And I know that we've talked a lot about this, just being on the physician side of it. just listening to your patients, and we had a great conversation on how, after your diagnosis, like it's like it gave you like an empathy, like when you're talking with your patients, and just to listen to them. And I just think that that is so important for doctors to listen to us. And we even talked about, there's a lot of doctors that don't. I mean, they're smart individuals. They just don't have that face to face, kind of way to communicate with the patient.
Oh, absolutely. There are physicians that just don't know how to communicate with patients, that don't have good bedside manner. And then there's also the limited amount of time that physicians get, that even if they want to, they can't. But either way, as a patient, it doesn't really matter whether they don't know how to do it because they're just not good communicators with patients, don't have great bedside manner, don't have that empathy, or if they can't because of external factors. Either way, as patients, we still bear the brunt of not having that from our physicians.
Exactly. I mean, I understand, that they are worked hard. They what I don't know what they give you guys, 15, 30 minutes per appointment. So there's not a lot of time to really have that one-on-one conversation. And I know we were talking about that earlier. And I think that's a real hard part on the physician's end, because you guys want a lot of physicians, they would love to spend more time with us and love to talk to us more, but they're whatever system they're working in, or whatever reason, the insurance, it's all about the money. I mean, we talked about that too. A lot of it's just money
Correct.
based.
Correct. I mean, yeah, there are lots of times, for example, in my practice, I have 30 minutes for a new patient, 30 minutes for an annual exam, 30 minutes for a hospital follow up, and pretty much 15 minutes for everything else, whether it be an acute visit, whether it be a follow up. I, I, I don't have the time that I want to have, but at the same time, it's also my job to make sure that that time is useful and beneficial to the patients as well. So, yeah, sometimes I run late because I have to give time to someone else that needs it. But you you can listen to a patient in a short amount of time. The first visits are always the hardest because someone that comes in with chronic illness, especially if they don't have a diagnosis yet, has a lot to discuss, whether it be their symptoms over months or years, or whether it be confusion about prior appointments with other physicians, other providers. It is hard, but it's also our responsibility to help those patients figure it out. It's it's a balance of both issues. Does that make sense?
Yeah, it does. It makes sense. I mean, you guys are in a tough spot. I mean, I understand, you guys, I'm not saying you guys don't make good money. You guys make good money, but I mean, it's all money driven. I mean, you guys got bosses too. The hospital system, they want the patients in and out. They want them in, 15 minutes. They want them out. They want the turnover. And you guys you're fighting that battle. I mean, it's like you guys are fighting. You want to be there for the patients, but you guys got to do what the hospital system wants to do. And I understand that.
Right. And, as a physician, even, I mentioned to you in our other conversation that I work 4 days a week. I work full time during those 4 days a week. The fifth day of the week, I'm also doing charting. I'm doing a lot of reading, a lot of studying, a lot of trying to figure out things for patients that I need to figure out, right?
Right.
But on average, I tend to work between 80 and 100 hours a week.
Yeah. Well, I believe me, I know that. I mean, we talked about that. I mean, you guys are open 5 days a week, and you see patients 5 days a week. But there's a lot more going on behind the scenes
Mhm.
when you're not seeing patients. I totally get that.
And a lot of fighting with insurance companies just to pay for a test or a treatment, but at the end, I don't want to make this sound like, oh, you guys should all feel bad for us physicians, because that's not true. At the end, because let's be honest, there are some real crappy physicians out there. But at the same time, yes, I appreciate it when people recognize just what you're saying. At the same time, in the end, we have to make sure the patients are getting the care they need as well. right?
Absolutely.
Does that make sense?
Absolutely, it does. Yeah, absolutely, it does. And so like I said, I mean, a lot of times your guys' hands are handcuffed by the system, just like our
Correct.
hands are handcuffed by the system too. And we're the patient, you know. And you're like on both ends of the spectrum now. You're the patient and you're the doctor,
Oh yeah, yeah. I definitely. I mean, before I was the patient, I was the mother of a patient, right?
right?
Um, we as patients are the ones that have to deal with the we have to physicians definitely we as physicians definitely have to deal with the system as well, but it is different than as a patient. Like as a patient, we're the ones that are sick, we're the ones that are needing the care, we're the ones that our care is either being delayed or denied by insurance or whatever reason. The physician that is an otherwise healthy physician gets to go home to their family and not have to deal with it. Now, it's going to be in the back of their mind. They're still going to be doing all the same fighting that I'm doing for their patients. They're still going to be doing the same studying, the same, but they themselves are not affected by it.
Okay, so let me ask you this, Summer. As a patient, if you're going into your primary care physician and you keep on telling them the symptoms and you're not getting the answers, and I get a lot of people that I do podcasts with that they say that they get gaslit by doctors. I mean, what would your recommendation to be if you think that somebody is getting gaslit by a doctor? I mean, what would you, as a doctor, say to a patient how to advocate for themselves?
Well, first of all, if you have to, find a different physician. And I know that's terrible because it's hard to get into a different physician. Just scheduling wise, all sorts of reasons that are completely valid on your end as a patient, right?
Right.
Um, so that's one thing you can do. The other thing you can do is bring someone with you. And I know that sounds silly, but there's a couple of reasons why. Is one, they can actually validate the things you're going through. So it's not just you telling the physician this is what you're going through. It's someone else also saying, yes, I see this. This is how it is affecting this person and us outside of just that person, right? The other thing is also understand that sometimes there actually truly isn't a good answer, meaning research isn't there. We don't have the testing now. If the physician is telling you, oh, well, well, gaslighting you essentially, ask them, is there anything that can test this? And they should be able to tell you yes or no. If they could say, well, I don't know, that is a clear sign to find someone different. If they say yes, then ask them why they're not doing that. Now, there may be a completely valid reason. Maybe it is that insurance won't pay for it until we jump through a bunch of other hoops. Okay, cool. Let's jump through those hoops. Even though that sucks and that shouldn't happen, let's do it.
Hmm.
The other reason maybe is maybe medically there's a good reason to not do it yet. Maybe they need to get other stuff done first, but they should be able to explain that to you. And if you don't understand, because again, some physicians are really poor communicators, ask them to explain it to you again and again. Ask your questions. And if they start acting, if they're getting up and walking out of the room, one, understand that maybe they don't have the time because they've got another 30 patients to see, but then say, okay, when can I reschedule to come back and ask this question? The reason being is because force them to give you a 1 month follow-up rather than a 3 month follow-up. In other words, that even if they either don't have the time or can't answer a question right then, if you have a 1 month follow-up instead of a 3 month follow-up, that gives them time to look up the answer, but also it allows you to sit back and have some time to come up with other questions that kind of put them in the place of answering me.
Yeah.
Give me some sort of information.
I always, and I had to learn this, Summer. I know I wasn't like this when I first started out when I was 27 years old. Pretty much just listened to doctors, and usually they would just talk to me in medical terminology that I didn't even understand. And I finally got to a point, probably when I was maybe 40 years old, where I would just look at doctors. I look at doctors now, and when they say something I don't understand, I go, "You got to dumb that down, man. I'm not that smart." And I just tell them flat out. I go, "I can't understand what the hell you're saying. You got to speak in my language because I don't understand that." And
Well,
I'm not ashamed to say that to doctors now, and I'll make them repeat themselves 5 times.
yes, you should. I am not look, I am internal medicine. I am not a neurologist. So there are times I ask my neurologist, wait, can you back up and re explain that to me? I'm a medical person and I don't even understand everything that is said.
Hmm.
So it is okay for you to ask them to explain it to you again and again and again. That is okay. And if they don't have the patience to do it, maybe it's that they're out of time and they have to see another patient. Okay, that's fine, but let's get a follow up really quickly so I can ask you this question and you can actually explain it to me.
Right.
If it's that they're just not willing to do that, then it's time to start finding a different physician. And by the way, in neuro, that is hard to do because of the wait times.
Yeah.
That is so hard to do. And that's not okay, but it is also the reality.
Yeah. I mean, it's a sad thing. I know we talked about this a little bit before, but I mean, I went through 2 neuros just to get my diagnosis. I mean, my first neuro,
Right.
he didn't want to diagnose me. He wanted the spinal tap, and I ran away from that. 10 months later, a different neuro, he diagnosed me. I mean, you got to do it. I mean, if you got to get your answers. So if you're not happy with a doctor, you got to bail on them and find one that you are.
Right. Right. And I know that's hard. I know that's a lot easier said than done when there's just not a lot of availability to get in, right?
Mhm.
I know that's hard, but that's also what you have to do. And if you don't have anywhere else to go, then keep asking, like, ask questions. Do not be surprised. Say you send a message in the EMR and you ask a 3 questions in one message. They're probably going to make you come in for a visit because they don't have the time to do a whole visit's worth of information via messaging. The things don't always come across clear to, but at the same time, you need your questions answered.
Right.
So ask them and yeah, go ahead and be a thorn in the side. Be polite about it. Don't
Right.
be rude about it.
Right.
Don't be but at the same time, be persistent.
Yeah, absolutely, man. I mean, I tell people all the time. I mean, believe it or not, the doctors are working for us as the patient. I mean, you're getting paid from our insurance. Whether it be the government insurance or whether it be private insurance,
Correct.
whether you're in the United States or whether you're in the UK or wherever you're at, the doctors are
Correct.
working for you.
Correct. You're also not a customer. Like it is a different relationship. What I mean by that is, yes, we are obviously working for the patient. At the same time, we're not a customer service representative that is our only job is to make you happy. Our job is to give you correct medical information and correct medical advice. Whether you take that advice or not, that's different,
Mhm.
but that is our job. So sometimes you're not going to be happy with our answers. And if it doesn't answer your question, then yes, please see another physician because you deserve having correct information. You deserve being taken seriously.
So
Always you do. You feel like you're not being taken seriously, see another physician. Demand a second opinion.
yeah, and this is a
You
doctor,
are
and
entitled to second, third, fourth opinions,
yeah, and this is
right?
and this is a doctor saying this. So I mean, we as the patient, I mean, we're searching for answers. That's all we are. We're searching for answers. If you're not getting them from one, go to another. It's just like if you take your car to one mechanic and you didn't like the work on the car, you're not going to go back to that mechanic. You're going to find another one. So it's just like a doctor, same thing.
Correct. At the same time, if you get 4 or 5 physicians that have all told you the same thing, then maybe there's not a great answer. What I mean by that is sometimes we just don't know. Technology isn't advanced enough. We cannot diagnose everything because sometimes there's not good testing.
Yeah.
Sometimes, and this is outside of MS because MS has some clear diagnostic criteria, but sometimes there are some diseases that are literally because everything else has been rolled out and we don't know what it is.
Right.
That doesn't mean that what you're experiencing isn't real.
Right.
It just means that there's also limitations on what testing is at right now. Sometimes there's not good answers. And I'll tell you this as a physician, that is highly frustrating. As a physician, it's even more frustrating for patients in that group.
Right. Right.
Like, you do have to be able to trust your physician, but to a degree.
Hey, Summer, I really want to continue this conversation, but I have so many other questions, and I know that we both have other things to do. And so I want to invite you back for a part two to this episode so that we can continue talking about your MS journey and just a lot of questions about you being a doctor with MS.
Oh, absolutely. Anytime. I'm happy to do that.
All right, all right. I appreciate you. All right, so I will come be back. There will be a part two with Summer on Wednesday, and until then, you can follow me on Instagram, MS Michigan Man 64. You can also find me on TikTok, MS Michigan Man 64, and you can find me on Facebook, Brian Wallace out of Brunswick, Ohio. Until the next episode, this is the Michigan Man. I am out.